Welcome to Decluttering 55 Plus with Michelle Passoff. This is the place to come for news you can use to get things done. Everybody knows that too much stuff is clutter, and cleaning it makes you neater and tidier. To us, it is a life management tool that helps you navigate your next steps. This is what my book, Lighten Up, Free Yourself from Clutter, is all about. As baby boomers, we have a lot in front of us that is confounding and confronting, so we sweep things under the carpet and put them off another day or forever. That is clutter because it keeps us stuck, and my new book addresses all of that. So we're going to bring experts, authors, and authorities here to talk with us about health, relationships, technology, finance, housing. What are you going to do next in life? Passing down your life stories, and even the challenges of making final arrangements. Here we aim to learn, open new possibilities, choose, take action, and create a legacy, not a mess. So let's get started. According to a study conducted by BLS, about 37 million people in the United States, or 14% of the population, provided unpaid elder care for the 2 years between 2021 and 2022. Over a quarter of them spent an average of 3.6 hours per day on care. According to an AARP study, those numbers are a bit higher, with 21.3% of Americans, or more than 1 in 5, among the ever-growing number of people providing unpaid assistance to an adult with health or functional needs. Let's talk about that today with our guest, Kate Granigan, a 25-year veteran geriatric social worker who often writes and lectures on the subject of caregiving. She's joining us today from Boston, Massachusetts. She's the CEO of Life Care Advocates and president of an organization called Aging Life Care Association. She's not only going to enlighten us on the subject of caregiving, but we'll discuss some of the resources available to caregivers and all of the many tasks confronting them. So, welcome, Kate. How are you today?
I'm great. Thank you, Michelle, and thank you for having me.
Well, let's start with the question, how would you define a caregiver?
Sure. It's a great question. In simple terms, a caregiver is a person who's assisting someone, whether it's a family member or a person with an injury or disability, with their activities of daily living, things like bathing and dressing, assistance with chores or house maintenance. So by definition, really, that is a caregiver. I think what you talked about statistically is really the definition beyond that, a family caregiver. And really, this is a family member or another individual, connected by relationship who provides a range of assistance. And again, this could be things as simple as food shopping and picking up groceries or prescriptions to doing much more hands-on care, assisting with personal care needs and those things.
Well, a lot of people in this audience are 55 plus, so they're not necessarily up to the age where they need care, but they have parents who are aging. I have a friend in Charleston, and comes from New York kind of almost every other week to take care of her mom or to keep her company or to even assist other caregivers in caregiving. So it becomes a big job. And she's 99 years old, so she's been doing it for a while. How do you decide when the time has come where you need assistance beyond even yourself?
Sure. Mm-hmm. Sure. So in general, thinking about when it's time to introduce a caregiver, whether again, it's the help of a family member or a paid professional that assists with care, really, there is no right answer to that. I think the important thing is when somebody's ability to take care of their needs is at risk, when they might be at risk, whether it's yourself really looking around and saying, I'm having difficulty getting down the basement stairs to do my laundry, or, getting to the grocery store has become really difficult, carrying my groceries in my bags in and unloading them with my health condition, my breathing condition is become taxing. So those are things to begin to notice. I would suggest that both people who see themselves needing care or people who are in the role of potentially being a caregiver or providing care, they often don't see that as clearly as you might think. It sort of creeps up on you.
That's just like a one-time incident or whatever.
Right.
Little
Yeah, I don't need
looking
that.
yourself in the mirror and telling the truth, I guess.
True. And I think even just for families, you mentioned your audience being in that place of probably themselves, finding themselves in that caregiver role or seeing it down the road a bit. The folks who in our work, and I've been doing this for over 30 years, really helping people first define themselves as a caregiver is important, because a lot of people are actually acting as caregivers and they don't even realize it yet. They're not identifying that way. And so really first, a lot of people say, oh, I'm not a caregiver. I just pick up groceries for my aunt down the street or my neighbor. I'm just picking up prescriptions. I attend a doctor's visit here and there. But quite frankly, those are roles of caregivers.
And what's the importance of acknowledging that you are a caregiver? Why is that important?
Yeah, I think what's important about that is that typically we say it's a marathon, not a sprint. And so it's often something that's going to go on for a long time. That's a typical experience. And you noted the hours that it takes a day when someone's in the throes of caregiving. So the importance of recognizing it is first sort of naming it so that you can begin to look at, what am I doing for myself? What do I need to have help with? Or what does my loved one need help with? And then where are the resources beyond me, maybe daughter or son or family, that might help us meet these needs, not just now, but long term. So those are
because a lot of people who may need care don't have children or family that is in the immediate area. So is this where I want to talk about the Aging Life Care Association and what kind of resource that can be to people who may either need assistance themselves, giving the assistance, or maybe long distance. Can you fill us in on what the Aging Life Care Association is?
Sure. So the Aging Life Care Association is a national association with members. It's a membership organization, and the members, roughly 2,000 across the country, are individuals that are professionals in the fields of nursing, social work, occupational therapy, physical therapy, health administration. So they're folks with backgrounds in the areas that one might think of that would have knowledge around aging. The role of an aging life care manager is taking that a step further and really understanding and knowing holistically and fully the needs of an aging person. It's understanding not just sort of biologically what kinds of disease processes and what things need to be addressed, but also understanding the finances of aging, understanding housing and resources, understanding complicated family dynamics that arise. So the job of an aging life care manager is to know the resources, having them vetted and understand where they fit in the puzzle of aging, and then helping family members or quite frankly, individuals who have no family members really have a roadmap for how to navigate this journey and what kinds of things they might need to consider, both in the moment and in a crisis, but also ideally planning so that they can have some understanding of what to expect and how to navigate that.
So would it be accurate to say it's kind of a clearinghouse? Like you'd come to this one resource, but like you say, it's holistic, that you'd get, right. You'd take a look at the finances, you take a look at the medical needs, you take a look at the mental needs. It's holistic, right, in the sense it's right. Every aspect. Yes. So how do you know when the time is? So first of all, we said if you're out of town and you don't yes. have, or you don't have anybody, that's one way. But what if even your family members are in the same city, but maybe they work or they have children? Is that when you know you should go to? When should you go to an aging life care member?
Certainly, there's a lot of opportunities to use an aging life care manager, either really as a sort of a assessment and recommendations kind of resource where someone can meet you or your loved one, understand holistically through an interviewing process, questioning, really knowing what to ask so that we can put a whole picture and plan together, and then providing family members or the individual with the resources needed. And sometimes that's all a family would engage for. That could be a couple of hours, really. Others really use an aging life care manager as a long-term member of their care team. They see themselves or their loved one as really benefiting from, you mentioned someone who is at a distance. So this aging life care manager might be what we call your boots on the ground. It might be the person that is in the town or the area that your family member lives, and can be the person that takes your loved one to the doctors and reports back to family, or assists in getting and monitoring help in the house, or any number of things. It's really quite a broad role and range of opportunities to help. And it really is an agreement and navigated between the individual and the aging life care manager. And it changes as aging does. We might be very interactive. Only, we have clients in my practice that we call our planning clients. They come to us, quite frankly, sometimes because they had an experience with their aging parents that was less than perfect. They were thrown into a crisis. They didn't understand they didn't have conversations about finance or, healthcare, or who their attorneys or financial planners were. And then mom or dad ended up in a hospital situation without being able to return home, and they were left guessing. So these folks,
like all of a sudden you're in the role of a nurse and you're doing a completely different job. How do you know? Right. I don't know. I know one time I remember my father saying to me, you know what? Don't be a nurse.
Yeah. Right.
I'm very good at that role, but.
Well, I think you just brought up a really great point that often is one of the major benefits of using an aging life care professional as a resource, because in circumstances where we are sons and daughters, we're not often the best people to be asking mom or dad to accept help or making recommendations. Those conversations are often tied with emotion. We maybe are very successful professionals, but in the eye of our parents, we're still a daughter, and you don't want to be told what to do.
Oh, that's a good point.
Yeah. So a professional that's objective and where the emotional connection and, quite frankly, the choice that older adult makes isn't going to change my life. And the outcome is then something we can evaluate pros and cons without the emotion, and really have an educated conversation about why do some of these things, not just because I as daughter think you should, or it's a burden on me, so I need you to do this so I don't feel worried or burdened, but more of a conversation that keeps the older adult, quite frankly, in control and making their own decisions, which, by the way,
that's a good
probably
point.
Been doing a long time. And they don't want to be.
How much does it cost to return the services of an aging life care associate?
Sure. It varies across the country and size of practice. The folks that do this work are anywhere from, what I would call a solo practitioner, somebody who's doing this, as a solo professional, to somebody who is running, like myself. I have a 20-person company. And all things in between. So it really, also the cost in New York City or Boston is probably much different than the cost in, some other more rural area. So
do they usually work on a retainer, or is it a per hour fee, or how does that usually break out?
A great question. And what I would say is it really depends on every practice is different. There are some things we all need to do and follow. And that is part of our membership in our association. That's a code of ethics, a standard of practice, and how we operate. And I can certainly touch on that. Beyond that, really how we run our practice following those things is very different. Some people have a flat fee and they'll say, I will give you an assessment and recommendations for this figure. Others do work by the hour. And others, may work under a law practice or in a home care agency. So really the place in which you find an aging life care manager, how they practice can vary. What you need to know as a consumer is, and what we really, what sets us apart is really those pieces of responsibility, our code of ethics and standards of practice that is important for you to know. And one of them, by the way, is when you hire someone, it is part of our code of ethics that you, and standards of practice that you, prior to engaging, you are clearly describing and explaining how your fees work. So that's really important. It's not a surprise. You should have a fee agreement. You should have a conversation. How will we be billed? How do you charge? How do we make decisions? What should be expected? And that really is important, for both parties. Would I go to Google and say aging life care associate in my neighborhood, or how do I find these individuals that are like a clearinghouse? Sure, I'll give you a better resource.
Okay,
You can go
good.
to
Thank you.
Life Care. Yeah, sure. Google's great, but sometimes Google actually comes up with things that people pay for to get to the top of the Google list that is actually nothing like what we're talking about. So
Okay.
we call it the Google curse. A lot of families use Google, as we all do, but unfortunately, not all resources are created equal and not all people have the same expertise. And aging is big business. So it's really important as a consumer and as a family member to do your homework and know who you're hiring and involving in your life. And so we pride ourselves at the Aging Life Care Association as being, following these standards. So you can go to it's called aginglifecare.org. So
aginglifecare.org. Don't Google. Go to aginglifecare.org.
Aginglifecare.org. And we try to make it as easy as possible. There's a lot of information there. But when you open that, there's a big orange button that says find an aging life care professional. And when you click on that, it gives you an opportunity to put in your zip code. And then it also gives you an opportunity to put in a range. It starts on default 25 miles, but if your loved one lives in a rural area, you may have to put in 50 or 100 miles.
Wow.
We are in most states and in most areas. However, we aren't, some areas are much more condensed. You'll find, within a 10-mile radius, you might find, 20 aging life care managers. Other areas you have to really work hard. So it is the resource, though, that will help you. And I often tell people, and I get calls every day when people, may look in my area or they know me and they know my business here in my area, but their loved one is in Florida. So, using that ability to connect, looking on the Aging Life Care, it will give you their, contact information, years in business, areas of practice, a link to their website. And then you can really, connect with a few people and make sure you ask the right questions like, what do you charge? What's your experience? This is my mom's situation. Do you have clients like that? Making sure that there's good matches.
So like hiring any other kind of professional, would you recommend if you're living in an area where you may have more than one life care, aging life care business to interview several companies, or what do you go on a reference or how to?
I would. All of those things are not a bad idea. Like you would anything, we wouldn't probably take our car to some unknown place to have it worked on. So certainly you don't want to take your car without at least a personal reference from a friend or family that's used that service, or calling and asking questions. Certainly we have people asking for references. We're often also recommended by other professionals. We get quite a few referrals through other trusted advisors like attorneys, financial planners. So if you have someone like that in your life that you know and trust,
that's a good idea.
It's possible they know someone they worked with other clients and can make a recommendation.
Now tell me this, Kate, what if I have long-term health care? Would this be a replacement for a long-term health care, or does it coordinate with long-term health care? What is the relationship? Is it distinct or related?
Yeah. So there's a couple of things there. I feel like, it's important to know long-term health care insurance has evolved for many, many years, and it's never the same. I started in this business when it was something that you cannot buy now, but many of our clients bought those products. So, an aging life care manager ideally can help you maximize your policy. We understand the policies. We can tell you what your benefits are and how to activate them. We can help you navigate and then also advocate to get the most out of them. So it's not necessarily a replacement because, but I will tell you, if we're looking at a policy, there's policies that we can identify a benefit. Sometimes it's called care coordination, or there may be a benefit there that your policy may cover some of our services.
Oh, that's
so interesting. Our services are privately paid for. Unfortunately, Medicare and health insurance hasn't caught up with the benefit of this service. So you pay privately typically. However, sometimes you may have a policy that has a reimbursement, and we're used to giving people information to get that reimbursement. And then these policies are often most often they're for things like home care or get assisted living or skilled nursing costs. And so we can help make sure that you're getting that benefit. We also help make sure you're getting, to the right assisted living or rehab or skilled nursing. And I think one thing to know about our code of ethics, it really does set us apart. Yes, you're paying a fee, but often when you're in the position of having to use some of these these services like home care or assisted living, you're already getting ready to spend quite a bit of money. Mm-hmm. And so, using a little bit of money to get the right recommendations can be invaluable and actually save you a lot of money in the long run. And we're objective. We do not take referral fees. We are, we're not taking a referral fee. We're giving you what is in your best interest. And
that's important to know that they're working in your best interest. Whoever said aging is easy, but being aware of what you may need and learning about the resources that can help you meet those needs certainly does help. We appreciate you coming on, Kate, and filling us in on the unique and important advantages of the Aging Life Care Association members. Look them up. Go to their website. Don't go to Google. AgingLifeCareAssociation.org. AgingLifeCareAssociation.org. If you have any questions or want any more information, be sure to go there. Have a wonderful day, and thank you for stopping by Decluttering 55 Plus with Michelle Passoff. Don't forget to invite your friends to stop by. Thanks. Bye. Well, that's all we have time for today, so let's wrap things up with a request that you go to our website, www.decluttering55plus.com, and click on the Let's Connect button. Share your thoughts, insights, and tell us the lessons you've learned. If you're facing challenges or celebrating triumphs on your decluttering journey, we want to hear from you. Connect with us on social media. Like us on Facebook, follow us on Instagram, and subscribe to us on YouTube. Let us know you're part of our community by rating and reviewing us from wherever you're listening from today. And don't forget, invite your friends and family, young and old, to tune in too. Let's include them in the conversation. The more, the merrier. Thanks for being with us today. And until next time, this is Decluttering 55 Plus with Michelle Passoff, wishing you a clutter-free day.